Good morning, good morning. Happy Mental Health Monday. Good morning. Welcome back in another week so we can continue talking on how to take care of our mental health. So this week is going to be the last week that we talk about the childhood trauma subject. I know you guys have been with me the whole month. I know, throughout the month, I know I trigger a lot of people throughout the month. I apologize for that. And how do I know? It's because people that I know personally is calling me or texting me and talking to me about their own trauma. So I love that. Thank you so much for that. But we have to educate and we have to talk about those things. So we are in our last video to talk about childhood trauma. That doesn't mean I will never bring it up again. That doesn't mean that I will never talk about it anymore. No, that's not what that means. That means is I am not going to completely focus on it. Because something that I love about mental health, it's everything showed up. It's like, it's everything is just meshed together. So you will see different things and different illness and different mental wellness and different ways of taking care of our mental health. You will see it in substance use, different type of mental illness. However, this is not going to be the main focus anymore. So I do hope if this is the first time you get to my channel, and then this is the first video you open, please stop right here. Go in the first week of April and start fresh, because you do need to start from the beginning to get here, okay? Because throughout the beginning, we talk about what is trauma, we talk about what is adversity, we talk about childhood trauma, we talk about sign of childhood trauma, we talk about what adversity that can traumatize your children. We talk about the brain, how trauma impacted the brain. We talk about different things throughout the month. So this one, I do have a subject, so you guys know I never finish something without, of course, talk about the treatment, right? So for today, for this video, we're going to be talking about treatment of childhood trauma. What are some treatments of childhood trauma? But before I start, I want to stop right here and ask you guys, did you do something this week to take care of your mental health? Talk to me. Let me know. Reflect. Think a little bit. Did you do something this week to take care of your mental health? What did you do to take care of your mental health? If you do not know what to do to take care of your mental health, I have a video. So look to my channel. There is a video. I believe I titled it Mental Wellness. And there's one for adults and there's one for children. So you can start implementing to be able to take care of your mental health. Did you do something this week? Something that I did this week to take care of my mental health, I take one day off from work to do nothing. I did nothing. I turned off my alarm for my work. I did not go work out that day. I did not clean. I did not cook. I wake up when I need to wake up. I shower. I eat. But I did nothing. I didn't drive. I walk my dog, but I didn't do no big things. Okay? And I just take the day. I walk in nature. I smell a rose. Okay? I feel the rain in my face. I feel the sun in my body. So I take a day to do nothing. I normally call it my mental health day. So what did you guys do this week to take care of your mental health? You do not have to comment it. I just want you to reflect on it. I encourage you guys to do something every week to continue taking care of your mental health. Your mental health is not something you do now and at the end. Your mental health is not something you put in the shelf and you keep going. You have to every day, every week, every month thinking about it and doing something to help you. Okay? So before I start talking about what is some treatment to do for childhood trauma, I want to talk about some prevention. Because besides, I already know you guys know what I was going to say about some treatment of childhood trauma. I know you know. I know you know if your children go through trauma, adversity, I know you know what I will say you need to do to get treatment. But before that, I want to focus on some prevention. Because without those prevention, you are putting your children in situation to actually expose to trauma. Okay? So one of ways to prevent your children from getting traumatized, one of ways to preventing your children from going to adversity is for you yourself to understanding your own childhood trauma. You need to understand what adversity that you went through and what did it do to you. How did it shape you? How did it make you different? How did it make you show up for yourself, for your children, and the world and the society? You need to know how your own trauma impact you. You need to know that. Not knowing doesn't mean you're not doing it. Not knowing doesn't mean that it's great. No, you might be thinking it's not showing up for you, but it's showing up. So you need to know your own childhood trauma. You need to know, did you process it? You need to know how it impacted you as an adult and as a human being, and as well as a parent. The next one is you need to know your child is a human being. You need to know your child is a person. You are not raising a little animal. Even animal has feelings, they have their own thoughts, they have their own personality. So once you know your child is a person, you know your child have their own mental wellness, they have their own mental health, they have their own feelings, they have their own thoughts, they have their own behaviors, they have their own characters, they have their own personality, they have their own rights, they have their own ways of being a person. They are a human being as well. You need to know that. You need to be able to implement it. Not only you need to know, but you need to be able to implement it. Safe coping skills at home. You need to be able to implement it. Self-care for yourself and your children at home. You need to be able to implement it. Healthy activities at home. You need to be able to implement it. Healthy relationship. You need to be able to implement it. Appropriate things at home. There is a time, there's thing that's age appropriate, and you need to know that. The thing is, I did not educating you guys about trauma and about adversity so you can naive your children or shelter your children. No, I'm telling it to you so you can educating yourself and your children so you can know what's going on, but for you to also be able to expose your children to it and for you to know, okay, there's an age for certain things. For example, there's an age for your children to watch a certain movie. There's an age for that. But there have to be an age where your children is allowed to watch a certain movie and for you to be there and watching them and letting them expressing the feelings. I remember when I was growing up, my parents never want me to watch anything that have kissing on it or that have someone is, like affection on it. And then there was never a time it was good for me to watch. If you're not teaching your children, you're not exposing your children to something, guess who's teaching them for you? Society, teacher, pastors, family members, other children, TV, social media, Those are the things that's doing that. You need to allow your child to be themselves. You need to allow your child to express who they are. You need to allow your child to be who they want to be. You need to allow your child to love themselves. You need to allow your child to be able to express who they are. You need to make sure not only you're educating yourself about what can traumatize your child, but you need to also educating your child. You need to know what can adversity your child so you can prepare your child. Know this. One of your main role is to teach your child, to prepare them for this world, to communicate with them, to support your children, to pay attention to your children, to show them love, to show them affection, to express your role as a parent is really to give your child a lot of different things and be there. Okay, so like I mentioned in my last, and I think 2 video before this, there is a lot of things that can put your child to adversity. But if you prepare your child well, they do not need to go through that. They do not need to go through a certain difficulty if they don't have to. But you have to prepare them. You have to be able to talk to them. You have to be able to be honest with them. You have to know what you are saying, how you are saying it. You have to be able to talk to your children. You have to prepare your child. Okay? So, now you're going to ask me, come on, Krista, the suspense is over. Tell me, how can I treat childhood trauma? If my children is going through childhood trauma, adversity, what is some of the treatment? The treatment is therapy. They need to go to therapy. Your children need to go to therapy. You need to go to therapy. That's where you can treat your childhood trauma. That's where your children can treat their childhood trauma. That's where your children can treat the adversity. In therapy, we do have different type of intervention. We do have different type of therapy that we do to help that children or that person or the adult process and treating their childhood trauma. Remember, I think in some video I talk about it. Remember, therapy is not just you go and talk. Therapy, we have things. We have intervention. We have medication, and I'm not talking about medication about the pills you take. That's not what I'm talking about. But we do have tools. We do have different things that we actually using based on a certain trauma. So there's different ones, and I want to take the time to explain them so you guys can understand. So one of them is CBT. CBT stands for Cognitive Behavior Therapy. Cognitive behavior therapy, the simple ways I normally explain it to my patient or to my clients or to people, I normally see it as a triangle. So this triangle look like that. And in this triangle, if you are following my hands, the top of the triangle is the cognitive. So cognitive behavior therapy is stating that the way we think go to the way we believe or feel, and it lead to the way we act. That's what cognitive behavior therapy is. So the way we think lead or go to the way we believe or feels, and then it go to the way we act. A simple example for this one is, if I think my hair is ugly right now, then I believe my hair is ugly. I believe some people might laugh at my hair because it's ugly. I believe nobody likes my hair right now. That can be a belief, and that can make me feel, maybe it make me feel ugly, maybe it make me feel shy, maybe it make me feel a certain way. Now, when I feel this way, I act a certain way. So maybe I can cover my hair with a hat, or maybe I can hide from people. Maybe I can even say, oh my God, my hair is ugly, right? So the way we think leads to the way we feel or believe, and then that leads to the way we act. So that individual come to work on what is this kid is thinking, and what is this kid is feeling or believe, and then how is this kid act. And of course, as an adult, we do the same way. Now, the next one that we use, the next therapy, intervention, medication, tools, skills that we use in therapy with a person that's either have childhood trauma or adversity is trauma-focused CBT. And trauma-focused cognitive behavior therapy, that's what it stands for, trauma-focused cognitive behavior therapy. So that therapist focus mostly on the trauma. So it's the same way with the triangle, but that person focus more on how is that trauma impacted the way this child think, and how is that trauma lead the way they're thinking, lead to the way they believe about the trauma, and how is that kid is acting about the trauma. So we work in therapy to make that, to kind of change that, to reframe that. And trauma-focused CBT start with coping skills. I love doing trauma-focused CBT. It's a very short therapy, but it's very intense. It's 12 to 16 sessions, and you have to see that patient twice a week. But it's very intense, very good. There's a part the kids talk about their trauma. They do it like a narrative, but it starts with coping skills. The next intervention we can use in therapy, a therapist can use, it's EMDR. The EMDR stands for eye movement desensitized. Oh God, I forgot what it stands for, but desensitized eye movement desensitized processing memory. I think I got it. I'll put it below in my description. So the EMDR, it's not a lot of therapists that qualify, that specialize on that. I am not. This is a 2 more years of schooling to do to get specialized on that. It's a very hard therapy. And what the therapists do is they use something to make it like an eye movement. So they use a clock. It's almost look like a clock. And then whenever that thing's moving, the person's eyes have to follow it. And what they help with this one is to process the patient memory about the trauma. So we use, not we, because I don't use that, but those type of therapists use the EMDR with individuals that have a hard time to recall the trauma. And a lot of trauma like sexually abuse, physical abuse, and we use it a lot sometimes to, like, that kids went to so much shock sometimes, like they're so traumatized, sometimes they don't remember the trauma. And we need that child to remember the trauma. The reason for that is if you do not remember it, you won't be able to heal from it. But you will act accordingly. You won't remember it, but you will act accordingly. But we needed to bring it to light so they can start healing the pain for that child. So the EMDR is a very intense techniques. Like I said, there's certain people that specialize from it, and you normally see it when that person specializes with the EMDR. You will see it in their credential. they will say they are EMD or specialized therapists. The other intervention that we use is family therapy. And the family therapy, it's a lot of adversity with that one. So like, let's say if the family is going to divorce, the family is going to a loved one, a loss of loved one, the family is going to poverty, or the family is going to COVID. So the family come together to address their feeling together, to maybe teach some effective communication, to maybe teach setting boundaries, to maybe teach how each one of us can hear each other. So it's a family therapy. Another intervention that we use with trauma to treat a childhood trauma is play therapy. And play therapy fall into the creative therapy as well. So play therapy, it's pretty much we use play to allow the child to express themselves, especially about the trauma, so the therapist can kind of correct in it. So I love play therapy with the kiddos, especially the 3 years olds, 3 to, I wanted to say 3 to maybe like until 8, that I will use play therapy. Although with adult, I use play therapy too. So it's depends where the adult is willing. But play therapy, it can't look like this. And then, like I said, it's creative therapy because you can use music therapy, you can use art therapy, you can use animal, you can use, I think mostly is those you can use, and creative therapy. So it's fall into the umbrella of creative therapy. So these techniques, it's mostly like for example, I can bring a bunch of like doll, right? I bring a doll. I remember one patient that I did that with, like a foster child. I bring a doll, and then we playing with the doll. And then I'm watching what she is doing with the doll. And then of course, she is like putting this doll completely naked, with her legs up, so she's showing what's happening to her while she's playing. And you can, even as a parent, you can like pay attention of what your child is doing when they play. For example, of a pet therapy, sometimes you can see that child is like very violent with this. I remember I bought a dog one time, and the dog was a therapist too. So I bought a dog one time, and I was working in substance use at that time, full of trauma, unhealed trauma and substance use. And you see individuals who's like, who was really aggressive with the dog, who was really like, get off me with the dog, while the dog is like putting her the head, licking, different things like that. So you can pay attention and see. So that's what the creative therapy came into play with childhood trauma, treatment of childhood trauma. Another type of therapy we use to treat childhood trauma or adversity is group therapy or peer specialist therapy. So the group therapy, it's let's say no more than 15 people that come together that have a shared trauma. So for example, let's say each one of those individuals were sexually abused. So they all come together to talk about their trauma, how do they feel, and you as a therapist, you guide the group. It's very effective with kids, especially like teenagers, that the group therapy is very effective. And the other one that I mentioned is peer therapy. So it's literally there's a peer that went through a certain trauma. The peer therapy, it's something that's very recent. Not that recent, but it's very recent. And I love working with peers therapy because those are individuals that actually went through the certain things, but they heal. They are on the other side of the umbrella. So for example, they can be a teenager, and normally we we peer people around the same age, around the same type of trauma. So for example, it's like a kid who's, let's say they are 12 years old. Like I said, it go really well with teenagers. So let's say if that teenager, so if I'm saying teenager, let's say 13 years old, and then they have another peer that is also 13 years old, and that 13 years old peer was also sexually abused at a certain age, but that peer, it's actually thriving now, and they heal, so they can like be together or even come to therapy. I normally do that in foster care, that I love doing it. Like let's say a kid that's been in foster care since that kid was like 6 years old, and then now that kid is like 21 years old, and now I bring that child to whatever group that I'm doing, or even to therapy, and then that child is telling her story or his story, and then but now that child is surviving. That child is working, going to college, going to school, or even therapy still, or even wanted to become a therapist. So they're surviving. I love that, and it's always so great to bring a peer, because the child can, like sometimes you as a therapist, they don't think you are going through your own things too, but when they are seeing someone who can relate to them, that work wonders. Okay, so I do not want this video to be too long, so I know you guys got to go, you got things to do. So I believe that's all the treatment, yes, type of therapy that a therapist can use, type of intervention that a therapist can use to treating childhood trauma, adversity in children. So like I mentioned to you guys, this is going to be the last video we're talking about childhood trauma. We are going to move on of other things so I can continue educating you guys on how to take care of your mental health. We always end our video with a dose of self-care, and that you guys already know, I always open it in the Creole one. So we already have it ready for you guys in the English one. So this one say, I love this one. This one say, believe in yourself and you will be unstoppable. Believe in yourself and you will be unstoppable. I believe in yourself start first. I don't know about you guys, but there's nothing under the sun. Sometimes I will tell my patient, or especially my teenagers patient, I will say sometimes, I will ask them, what do you want to be when you grow up? And they say, I want to be a billionaire. And I'm like, yeah, there's nothing that will prevent you from becoming a billionaire. Because as long as you believe in yourself, it's already there. The money, it's already there for you to access. The billionaire is already there for you to get there. You just have to believe in yourself. So I'm encouraging you guys to have a great Monday and a great week. We'll see you guys next time. Have a good one. Bye-bye.